What's up, guys? This is Matt from GoTherics. We asked Chat GPT what are the 10 most common questions that someone asks a physiotherapist. They are here in this video. Stay tuned. All right, so the first question is, what is causing my pain or discomfort? Well, what causes your pain or discomfort varies quite a bit. If you're coming in like most people, where you haven't had surgery or you haven't had a specific time or event where something occurred and broke, or it's very obvious what's going on, then you have what's called insidious onset. And insidious onset is going to mean that you have something that it just kind of developed over time. You're not sure exactly when it started, but over a certain period of time, it started to get worse. So with something that is an insidious onset, what you're going to find is we have to determine first what type of tissue is involved. So in general, for physios, what we're trying to look at is if it's something that burns or tingles, we're often thinking it's probably a nerve. If it's something that kind of tingles and feels cold, that may be a blood vessel. If it's something that burns and is hot, we're more thinking nerve. If it's something that occurs in kind of a general area, so like if I have knee pain and it's just kind of across my knee, we're thinking knee pain around here likely could be coming from something nerve related. If it's right there in that specific point, we're thinking there's probably a structure right there that has been damaged. We're also going to look at things like the activity. So if I have a pain here and I squeeze this muscle and it hurts, and I stretch this muscle and it hurts, then it probably is that muscle that is damaged. But if I squeeze down and contract the muscle and I stretch the muscle and it doesn't hurt right there when I do that any different than something else, now I have to start to think, well, why do I feel pain here, and could it be related to something else? So the complicated question to what is causing my pain and discomfort, if you're coming in and you don't have an obvious injury or you haven't had surgery, is generally going to be something of, well, it depends, and we need to check and see if the pain that you're having is related to something directly in that area or related to something else. Nerve pain is what we call referral pain. Referral pain means that the pain that you're having is being referred by another area. Generally in our legs, referral pain going down the legs comes from the low back. Referral pain that goes down our arms and our shoulders generally comes from the neck. So we are generally going to look at those areas to see, is there something in the back of the hips that could be causing this diffuse knee pain or diffuse foot and ankle pain? Or is it something where as we use that foot or ankle, it changes the pain and thus means that that's where the pain is located? Now, as an aside, I have found multiple cases where people come in and it is a little bit of both, and that's where it can be very complicated. So if you're going in and you're not getting an answer that you like, they're saying, oh, the pain's in your head, or they're saying, oh, the pain is definitely here in your knee, but like you're noticing that it's diffuse pain and it's not a specific spot, then get a second opinion, because often what you'll find is that it's not just pain in the knee as a result of whatever your MRI said was in the knee, and said actually it's in the back in combination with an injury in the knee, and then you need to resolve both or you're going to end up sad. And I've had plenty of people post-surgery that end up really sad when they get that same knee pain that they had surgery for, and it comes back in the recovery, and then they realize, oops, it was my back the entire time. All right, how long will it take to recover? That varies a ton. So tissue healing is really often what determines this. So if I'm doing something like I'm looking at, say, an ACL tear. ACL tears, the research shows that you've had an ACL tear and repair, that your outcomes are significantly better after 12 months or a year of rehabilitation. That is just what we found in research. There are people that come back quicker than that, but the research tends to prove that the best thing to do is to actually take the time to allow the tissue to heal. And there's going to be various healing times within that. The time it takes the graft to set and things like that. Bones, generally a bone break, you're talking 4 to 6 weeks, probably 8 to 12 weeks for you to get full strength and full impact back on that bone. And then when you're talking about skin healing, it depends how many layers have been taken off the skin. Skin, if you have a major skin lesion, like pressure sores and things like that, they can take a very long time to heal, even up to a year, just because of how extensive that can be. So, we're looking at tissue healing times. I'd say the majority of people that come in to see me for something like low back pain probably take about 6 to 12 weeks to get better, depending on how serious it is. That can even be people who are like crying in my office and fear surgery, that in 10 to 12 weeks, they're perfectly fine and back to everything they like to do. So that's a general rule, is most things 8 to 12 weeks and you're good. Do I need imaging, X-ray, MRI, etc.? Well, I kind of went over that just a second ago, and that is, well, maybe. In some cases, imaging can actually send us in the wrong direction. So I have lots of people that will look at their image and they'll say, oh, I have a degenerative disc disease, or I have, a torn labrum, or whatever it is, according to that. But then when you talk to them and you ask them, you realize that they're not really affected by whatever's torn or by whatever's degenerated and so on. And that it's really something else that's actually bothering them. And that's kind of the key, is our bodies are way more complicated than can just be interpreted on a photo or some type of imaging. There's a lot more that goes into it. As I said earlier, you can have knee pain or hip pain that could be both related to the hip as well as something else that's referring pain to that area. And that's what I see in many, many of my clients, is that they'll be like, yeah, I went to the doctor, they couldn't figure out what was going on. And often what it was is because they're going, oh, well, I have knee pain. And so then they start looking directly at the knee, and then they realize, wait a second, the knee is just one component of that. And it turns out they have back sciatic pain that comes down to their knee, refers down to the knee. And in addition to that, they due to the way they've been moving lately, they've been making some changes in that, and they do have some pathology in the knee as well that's causing pain, and it's a combination. And so instead of just looking at the MRI and saying, oh yeah, we'll scope the knee and you've got a torn meniscus. Everybody has a freaking torn medial meniscus, right? That doesn't always mean that that's what's causing the issue. So you go in there and you clean it out, and then you go back and you're like, hey, I'm 8 weeks into rehab, I'm 12 weeks into rehab. I have that same pain back in my knee that I had before now that I'm active again. Oh, it's because it turned out that your lumbar spine was agitated and that you had sciatic symptoms referring down to your knee, in addition to having a frayed meniscus, which is exceedingly common as we age especially. So MRIs and imaging can be helpful, especially for bone breaks. I always recommend it. But you're looking at me, I have degenerative disc disease at L5-S1. In fact, I saw my last CT. It's virtually bone on bone. I have zero pain, zero agitations. I exercise all the time. I'm in here deadlifting, squatting. I play soccer. I run. I jump and roll around with my kids and wrestle and do stuff in here all day long. Degenerative disc disease? Who cares, right? We don't need to look at an image and define ourselves based on the image. Instead, we use the image as a tool to interpret what our pain is, and it can sometimes give us more info. All right, next one. What exercises should I do and or avoid? That is a great question. That's one of my favorite questions of this series. And the idea is that we need to do exercises that encourage our body to release the tension or increase the muscular stability of whatever joint is bothering us. For the most part, with physical therapy, we're dealing with people that have issues that are going to be with joints. And we're looking at how we can stabilize those joints, how we can mobilize those joints by activating the structures around them. There are some things like frozen shoulders and things like that where it's going to diminish over time what you're able to do until you're in that thawing phase where you're going to increase the motion that you have, that where you have a tissue that can't really be manipulated very well if you're in that freezing stage of the frozen shoulder. But most of the time what we're going to try to do is we're going to try to do things that are going to activate and are going to increase the overall pliability as well as stability and strength in those tissues. So we often feel like that what we need to do for something that's tight is stretch it, but it's not always the case that it needs to be stretched. Often something is tight because it's weak, because it's spastic and it's not working well, and so therefore it tightens down. And what we need to do to loosen that is strengthen it. We need to get it activated more. Often I'll talk to people as kind of thinking about neuromuscular activation as a bit like a light switch. Like, you know, if you had a light and it was flickering, the first thing you do is walk over and turn that light on and off. That's the equivalent of if you have a muscle and it's spasm and it's tightened down, that you turn that muscle on and off, and it helps to release some of that tension that it's having, and it can help make it stronger and more stable. So a lot of what we do in therapy is actually to perform in a controlled manner the exercises and movements that actually agitate your pain. Maybe we don't fully agitate the pain. Maybe we go just on the cusp of it. Maybe we move into discomfort. So when we talk about discomfort, we're like looking at a pain scale and we're saying like a 4 or a 5, a 3. We're not talking about a 7, 8, or 9 type pain. We go into some discomfort, and that helps us to actually, get things moving a little bit and to relieve that pain. I mean, there's guys on YouTube like knee over toes guys that make a career out of the fact that avoiding the thing that causes you pain often just causes you more pain. You have to, graded exposure to that is going to help to increase your stability and make you stronger in those ways. So we're generally looking to do the same exercises that you're doing, but we're going to grade them appropriately so they're at the level of which provides you a positive stimulus in terms of a negative stimulus. And that's why you need a professional involved. All right, can physiotherapy help with your condition? Well, if your condition is musculoskeletal or neuromuscular in nature, then very likely physical therapy is going to help. If your condition is something where it changes the way that your body's set points are, or it changes the way that your body moves, that muscle tension is related, or that you are having something that's systemic like osteopenia due to a lack of activity, due to a lack of forces on structures in your body, then definitely physical therapy can help. But if you have something where what you really need is some type of change within your body that has to do with your immune system, physical therapy is not directly going to impact that. It can indirectly impact it, but that's not really where physical therapy is going to be the most beneficial intervention. The best thing to do is to meet with a physical therapist directly to see if what they have to offer is something that's going to help. Even a lot of physicians that refer to therapy aren't fully aware of the breadth of what therapy can do, and a lot of therapists themselves self-limit into areas where they're not really approaching all the things that they would be able to do. That said, if we're talking about some crazy things I hear that chiropractors say, like that they can resolve colic and other like gases and stuff like that by manipulating the spine. Yeah, that's just dumb. And physical therapists aren't going to resolve colic in an infant by, doing spinal manipulations or giving them a massage. That's not the type of thing that we do. What we're going to do is we're going to give, specific manual treatments as well as exercise-based therapies that are going to enable you to build tension in ways that you want and release tensions in areas that you want to release that tension. How often do you need to come in for treatment? I love this one. Well, if you go to a, crap in-network, physical therapy center and they only give you 15 to 20 minutes with the physical therapist and the rest is with a college student who's, practicing because they want to learn to be a therapist, you're probably going to go in there for a lot of visits. First of all, because they want you to come in for a lot because that's how they make money. Second of all, because you're not going to get a lot of time and attention from the pro, and so therefore you're going to need more time in terms of the number of times you come in order to be with them. If you work with somebody who's cash pay like me, we're very biased that we're going to spend the entire hour, the entire time you're going to come in is going to be with us. So we're able to do a lot more because you have the professional that you're seeking out that's going to be directly working with you. Overall, most of my clients early on, we're going to work with them from 2 to 3 times a week max, usually 2 times a week max. And then after the first month, after the first 2 weeks, depending where they've kind of passed that acute stage, at that point, then we're going to move to some type of schedule that's going to be something closer to once every week or once every 2 weeks. And then we're going to schedule those out even once a month, once every 3 months as they get further into their rehab. The reality is that the homework that your physiotherapist gives you, that is going to be the number one thing that's going to help you to get better, not what you do in clinic. So going to clinic more times shouldn't be what you're relying on to get you better. What you should be relying on is you go into clinic to get those things where it's hands-on in the manual treatment and the guidance and corrections to be able to do your home routine better. And that is the purpose of it. So at one point, you're no longer going to see a change in your tissues due to manual treatments and so on. And you also are going to know your exercises and how to perform them. So therefore, you don't have to be in there all the time. You need to go in when it's time to change something, when it's time to make it more difficult, when it's time to ensure that you're doing it correctly and so on. As you get stronger, the time in between gets larger and larger because you don't need to be in there every week or even twice a week when you're 8 to 10 weeks into care, because the reality is that the tissue changes at that point. You need to repeat the same routine for a longer period of time to see change than you did at the beginning. All right, let's see, next one. Will it hurt during or after treatment? Yeah, probably will. If it hurts during treatment, it should generally be a manageable pain. If it hurts after treatment, it should be pain that doesn't last very long if it's in a joint, or it should be muscle pain and soreness. And learning to determine the difference between muscle pain and soreness and joint pain or nerve pain is an important part of therapy and is part of what a good therapist is going to guide you through so that you are able to gauge whether your pain is a positive pain where you're learning how to move and your muscles are getting stronger, or if it's a negative pain where what you're actually doing is just agitating whatever it is that is the issue. I talk a lot about with my back patients the idea of picking the scab. Inside our body, you have tissues that are healing. Just the same way as in your skin when you get a cut, and if you rip a scab on and off, again and again, you know it's not going to heal as quickly, and as well, the same thing can happen in your body. And if you keep agitating that injury, you're picking the scab, and it's going to be harder for that to heal. Should I rest or should you keep moving? Well, you should always keep moving, but the amount that you move is going to depend greatly on the injury that you have and how that affects you. If you've injured your shoulder, you have your entire body that you can still use. If you've injured your foot, you have your upper body that can still be active in doing things. Activity is a good thing. And in general, bed rest or doing nothing really only leads to more pain and more dysfunction. So overall, our goal in physical therapy is to try to keep you moving as much as possible while having you heal. And a good therapist, a good physician is going to have the goal of getting you moving early and often and as much as possible while allowing whatever injury you have it is to heal along the way. What is the difference between physical therapy and other treatments? So the difference between physical therapy and chiropractic, from a physical therapist perspective, which is what I am, tends to be more that physical therapy is going to be more within the medical community. It's going to be more evidence-based on generally agreed principles within the medical community, not just within the specific community of physical therapy. It's going to involve modalities that have been researched and approved by the American Medical Association and by the Physical Therapy Association. Things that are going to focus generally on manual treatments and then the use of manual treatments to then provide a stimulus to improve exercise-based treatments. If you are in other disciplines such as massage therapy, they're going to be focused primarily on soft tissue and releasing tension of soft tissue. Chiropractic focuses a lot on the spine and then the manipulation of joints in order to realign them. A lot of the medical community, including most physical therapists, don't agree fully with the idea of realigning bones and joints using manipulations. I will tell you that, we learn how to do that in physical therapy school, and it's basically just releasing gases. And if you think releasing gases like popping your knuckles is going to reset your whole system, then, good for you. I don't think that's going to reset your system. But if it does create a positive change, causes you to relax, causes you to move better, and you do exercise as a result of that, hey, that's manual therapy, and that's awesome. So it's all about how things are used and whether it's an endpoint or not. Manipulation of the spine in and of itself is not going to resolve your issues that you're having, but manipulation of the spine that leads to better movement patterns and leads to you doing more, being more active, and taking back control of your life, that is going to help. All right, last one. Can we help you avoid surgery or medication? 100%. Like I said, I have many people come to me that are looking at issues with their back, with their knee, and what we do is we provide them either, permanent or semi-permanent type training and therapy in order to keep them from needing to have surgery. A good percentage of leading physicians are moving away from surgeries for rotator cuff injuries, for back injuries, for knee injuries, and instead are pushing towards as much of therapeutic care and rehabilitative care as possible, because in the end, the outcomes are very similar. And it's also a case of you generally do surgery and have therapy after anyway. Why not give therapy the chance for 6 months or so to see if it makes a difference? In many cases, it makes all the difference. A lot of it, though, comes down to the individual and the timing, and as well as the person that you are. People who excel in avoiding surgery and physical therapy tend to be the type of people that they do their exercises, they go to their therapy, they pay attention, and they're going to stick to the routine that the professional is guiding them to do. People who do poorly and need surgery instead are people who do not listen very well, they don't follow the directions, they do more or less than what is prescribed for them, or people who just don't have the time to spend to allocate to doing these therapies and so on. Because therapy is genuinely the hard way. It's not the easy way. So yes, it can help you to avoid it, but you're not taking the easy way out. You're kind of taking the hard way out, and you have to be willing to put in the work. So that was the top 10 questions from Chat GPT. I hope that you've enjoyed this video or video series, because we ended up doing a lot of time on this. I am Dr. Matt Rochelle, physical therapist with GoTherax, and you got some raw thoughts in this one. Let us know in the comments below what you thought of these top 10 questions. Thanks.